Which of the following values would be considered a normal erythrocyte sedimentation rate? ESR? A. 18 mm per hour. B. 34 mm per hour. C. 72 mm per hour. D. 45 mm per hour. The answer is A. 18 mm per hour. A normal erythrocyte sedimentation rate should be below 20 mm per hour. Anything above this indicates some sort of inflammatory process. Which of the following is considered the normal range for specific gravity on urinalysis? A. 1.015 to 1.035. B. 1.010 to 1.030. C. 1.001 to 1.020. D. 1.005 to 1.025. The answer is D. 1.005 to 1.025. While adults may have a specific gravity that ranges anywhere from 1.000 to 1.030, the normal reference range is generally considered to be 1.005 to 1.025. A specific gravity below 1.005 could indicate very dilute urine. The specific gravity of water is 1.000, and anything higher than 1.030 may be present in the case of dehydration, kidney disease, infection, or glucose in the urine. Blood pH is maintained by the body in a very close range. What is the normal range for pH of the blood? A. 7.35 to 7.45. B. 7.37 to 4.47. C. 7.32 to 7.42. D. 7.34 to 7.44. The answer is A. 7.35 to 7.45. The normal range for pH of blood is 7.35 to 7.45. Anything below that range is considered to be acidosis, while values above that range would be considered alkalosis. Recall that the main blood buffer system involves carbonic acid, bicarbonate, and carbon dioxide. Which of the following is not determined by urinalysis? A. Specific gravity. B. Presence of blood. C. pH. D. Presence of bacteria. E. All of these are determined by urinalysis. The answer is E. All of these are determined by urinalysis. A urinalysis can be an important tool in diagnosis conditions such as the presence of kidney stones, urinary tract infection, and even dehydration. A typical urinalysis will contain information on all of the parameters indicated. The presence of glucose, ketones, crystals, casts, and leukocyte esterase may also be included. Washed red blood cells are generally administered to which of the following patient populations? A. Patients with metastatic disease. B. Patients who are immunocompromised. C. Patients with a history of allergic reactions to transfusions. D. Patients with chronic kidney disease. The answer is C. Patients with a history of allergic reactions to transfusions. Washed red blood cells are generally prepared for patients with a history of severe allergic reaction to blood transfusion. Washed red blood cells are not generally required in patients with kidney disease, patients who are immunocompromised, or patients with metastatic disease.